Hello and welcome to this week's edition of NHIS in a Week. We bring you highlights of events within the authority and the scheme. To our top stories, NHIA deepens decentralization of its operations for efficiency. NHIA Chief Executive keeps faith with Lojokuku residents as he takes time off to engage in medical consulting at Lekma Hospital. Dr. Ernest Oforisapon, founder of Special Eyes Investments, Lord's NHIA CEO. Now to our first story. The Chief Executive of the NHIA, Dr. Okoboy, has stated that the decentralization of the operations of the authority will ensure the efficient running of the scheme. He made this known when he interacted with staff of the NHIA in the Western Regional Office as part of his tour. He said that segmentation of NHIA's operations within northern, middle, and coastal belts will be supervised by directors who will report directly to him.
We also want to push hard on decentralization. Suggest to us how we can make things more decentralized. We have some nice ideas. Already we've created belts with the approval of the board. NHIA, instead of everybody running to the center, we want regional directors to have somewhere they can go, not necessarily Accra. And luckily, the head of the belt will be closer to the regional headquarters. A belt director is supposed to be like a mini, it's like a shadow Okobo, like myself. See you. So if you have some issues which don't need to come to me, you should be able to handle it, supervision. But when you come to Accra, then it means that things are really serious.
As part of the CEO's working visit to the Western region, some members and management of the NHIA visited the Ahantaman and Shama district offices. The visit was to connect with staff and have a better understanding of the operational challenges affecting the scheme in the region.
So we came because we have to know you in person, see where you are, and have a feel of your work environment. NHI is one family. There is no Accra NHI and Ahantaman NHI. We are supposed to be one family. We have to find ways to make sure that at any point in time, we are all together. And because I cannot be working here and at the same time working in Accra, and because you cannot be working here and at the same time working in Accra, we can be at different places, but we have to have a common language. And the common language means that where are we going to as an organization? Where are we now? And what are we here to do? Every staff must know, whether security, clerk, accountant. And that's why we came up with the 5 Ds. Next year we have 20 years.
Chairman of the Board Subcommittee on Welfare, Dr. Sylvester Yaopon, urged staff to protect the legacy handed over and to do their best always, but be measured in their demands of management. The board chair, Dr. Ernest Kwaku, was also in attendance.
It is our own authority. This is our workplace. This is the legacy that has been given to us. And we have to protect it. We don't have to destroy it for the benefit of short-term interest. So let's always keep this in mind, that we need to protect the integrity of the authority and then make its image improve continually. So if we decide to take everything out of the PT because we want to satisfy ourselves today, what work would there be for us tomorrow?
Moving on, despite his busy schedule at the National Health Insurance Authority, Chief Executive Dr. Okoboy has reappropriated his timetable to do general consulting services. As a professional medical practitioner, Dr. Okoboy on Monday, August 15th, spent considerable hours at the Lekma Hospital in Accra, where he interfaced with 20 patients, 17 of whom were active members of the National Health Insurance Scheme. The patients who were privileged to have the chief executive attend to them commended him for not abandoning the Lekma Hospital following his appointment. Dr. Okoboy urged them to promptly renew their membership cards using the mobile renewal service shortcode *929#, as the NHIS remains the surest way to reduce out-of-pocket payment of healthcare services. He emphasized that the best way to determine whether a social program like the NHIS is effective is to participate in it. He intends to keep faith with Lejukuku residents and provide his professional services through consulting at the hospital. A 6-member team of the Presbyterian Boys Secondary School Presec Old Boys Association, led by the global president, Dr. Ernest Ofori-Sapon, has paid a courtesy call on the CEO of the National Health Insurance Authority, who is also a proud member of the Presec alumni. The visit by the Old Boys of Presec, popularly known as Odadie, was to officially congratulate Dr. Okoboy on his appointment as Chief Executive and to pledge the association's support for him as he steers affairs at the NHIA. Dr. Ernest Ofori-Sapon, a businessman, entrepreneur, and founder of Specialized Investments Limited, lauded Dr. Okoboy for his excellent show of leadership, competence, and commitment to public service. He also assured him of the alumni's support, reiterating that members of the Presec Old Boys Association and their families will be encouraged to enroll onto the NHIS as a preliminary measure of supporting one of their own.
And this morning we are here on the ticket of the Global Council to formally wish you well, to say welcome and also to congratulate you on your new position as the CEO of the National Health Insurance Authority. And we want to say that Presec as an institution where you attended school is solidly behind you, will serve as a pillar of support for you. Thank you. It is our prayer that you have a very successful tenure of office. Yeah, I'm sure to most of us, we know your level of competence, and we strongly believe that for whatever reason that you were brought here, you will deliver and then live up to expectation. We want to tell you that at any time and point, if you need any support from your old students, do not hesitate to let us know. And that the rest of the family said that should come and then wish you well. I should come and say congratulations on your new appointment, and that we are with you. Wish you all the best in your new position.
Dr. Okoboy expressed his gratitude to the association for the honor done him, adding that he owes his leadership skills, zeal, commitment to work to his alma mater Presbyterian Boys Secondary School for the selfless values instilled in them. He also thanked the president, Nana Addo Dankwa Akufo-Addo, for giving him the opportunity to serve.
Let me say that I want to first of all thank your team. I mean, your group of executives have made a significant impact since you came to office. Reverend Markwe did a wonderful job, and you've taken over, and you are also continuing with the good works. I am thankful to the Almighty and also to His Excellency President Nana Addo Dankwa Akufo-Addo for his benevolence bringing me here to come and help push the agenda of insurance in the medical space. The National Health Insurance Authority is the regulator for the medical insurance space, both public and private. And we wear two hats. We also run the biggest national health insurance scheme, public one, in this country. And I happen to be the chief executive for both. And I'm very glad that Presec Legon has its values being shared here through my presence as the chief executive.
Up next is Health Tip. This week, we take a look at stroke. NHIS Titbits is next.
Did you know that NHIS covers 95% of ailments that are presented in the Ghanaian healthcare facilities? Register onto the scheme or renew your membership by dialing *929# on your mobile phone and take advantage of the generous benefit package available to its members. NHIS, your access to healthcare.
This is how we wrap up this week's edition of NHIS in a Week. For more stories, do log on to our website, www.nhis.gov.gh. Subscribe to our YouTube channel, NHIS TV, and follow us on all our social media platforms. My name is Vida Educhumwa Boating. Thanks for watching.